Workers in our area who didn't believe in the virus but then have become victims of it, like millions of other people. Jessica Archdale is a quality safety regulatory specialist at OSF Healthcare.
I was skeptical. When COVID first came out, I thought it was for political gain and a lot of media exposure.
Archdale started feeling sick during Thanksgiving of last year.
My symptoms began during the middle of the week. I had just started sneezing uncontrollably, and I contributed it to there's some tree work that was being done at my neighbor's house, and I have allergies, and I thought, oh well, they're doing tree work, and this is my allergies flaring up. It was just nonstop sneezing.
Saturday morning, Archdale said she felt like she'd been hit by a truck when her mom called to tell her one of their family friends had tested positive for COVID-19.
We were just around them that previous weekend. So it dawned on me that I was like, okay, well, maybe I should go get tested.
Archdale, in fact, had COVID and was told to go home and isolate from her family. She began to check her pulse and oxygen levels, and when they started to get low, she went to the ER.
Jessica came to see me in the clinic with persistent COVID symptoms.
That's where the man to Jessica's right comes into play. Dr. Jared Meekard was the one who took care of Jessica after she got the virus. She had COVID long hauler symptoms, which he says has plagued a lot of people.
80% of patients that end up with a COVID infection have symptoms lasting at least 2 weeks. Some people, these symptoms last up to 6 months or more.
Jessica stayed in the hospital for a day and then was sent home. But as we all know, over the last year and a half, not everyone else's case has gotten better.
After I had went home, our family friend had died, and it really shook me to my core that how quick it had happened and how I was struggling to breathe, and I didn't know if this would affect me poorly or if I would need to be required to be on a ventilator or anything like that.
Still worried, Jessica started writing letters to her family, telling her husband account information that he may not have known before.
It was things that I felt like, if I am unable to speak, then I want you to know these things. And so yes, it shook me to my core. I was very scared.
You thought you were going to die?
I did, yeah.
Now, on top of all of this, Jessica had pneumonia. She went back to the ER a couple of days later, but workers were able to treat her with steroids and she was able to go home again. So who was that man on the left of Jessica? Well, that's Dr. Mark Meekard, that's Jared's father, who's been studying COVID since it began. We'll tell you his advice for the community, how effective the vaccines are in fighting the virus tomorrow right here on Good Morning Quad Cities.